Hi, this is Dr. Tayani, board certified ophthalmologist. Today I'm going to be showing you a video of modern cataract surgery without using the laser. This is a manual technique. Here we're starting with the keratome, using our 1 mm keratome, making a peripheral incision to the cornea. And here the next step is using a special gel that firms up the eye, preparing us for the second incision to be placed. Constant irrigation over the eye is important during cataract surgery. And here's a 2.4 mm keratome that is entered into the eye to make the primary incision. Here we're using a special cannula that helps create what I call a can opener. It opens up the skin of the cataract. If we use a grape as an analogy, it's like we're peeling the skin of the grape to get to the body of the grape, which is the cataract. It's probably one of the most important steps in cataract surgery to be done meticulously well. If we were using the laser would be doing these cuts for us. So that can opener is now completed. And here we're using a fluid, water, to dissect between the skin of the grape and the body of the grape, which is the cataract. Once that's done, it's loosened, and then here we're using the ultrasound technology to break up the cataract into 4 quadrants. We make deep incisions within the body of the cataract, and as we do that, we rotate the lens around. It's very important to try to keep the back skin of the grape intact during this procedure. Here we're making the second groove, or the second quadrant, within the body of the grape. We continue rotation, and the third groove is being made. And once those grooves have been positioned, we use the 2 instruments to break each quadrant apart. We take careful measures to avoid breaking that back capsule of the cataract, because if that was to break, then that's considered a complication within cataract surgery, which we do not want to see. So now we've broken the 2 quadrants into 4 pieces, and now we use a high suction on the ultrasound to vacuum the quadrant, each one, by bringing them forward. You'll see here in a moment. Here it comes. We bring it forward into the front part of the eye, and with ultrasound technology, break up the cataract into small pieces, or otherwise known as emulsify, and suction it out. Once this is done, the major component of the cataract has been removed. However, you see those flaky portions left behind. That's a part of the cataract called the cortex, which is underneath the skin and above the nucleus, the body of the cataract. And then we use an irrigation aspiration technology that irrigates and removes, sort of like a banana peel, the cortical material, or the second layer of the cataract. And there is the final piece, completely removed. So now we have what I call a hollowed out grape with removal of all the cataract particles, and ready to have the lens implanted. Here we use a gel to firm up the eye and protect the capsule in the back of the eye, and we inject the lens into the bag, or into the body of the grape, if you would. And as the lens goes in, it goes in like a taco, and then unfolds with the heat of the body. And here we're using a multifocal lens, the Vivity lens, which allows the patient to see without glasses postoperatively. And then we suction the gel out, And then here we're firming up the eye by using a water to firm the wounds, the incision lines, so that we don't need to use any sutures to close the eye. That completes the cataract surgery. Thank you.